Hi, I'm the educational consultant for advanced clinical documentation for nurses and other clinicians, and I have the pleasure of speaking with Ms. Petagaye today. She is a nurse practitioner. Her specialty is psychiatry. And also she has an extensive background in med surg. So we're speaking with her today to kind of just get an idea of what it's like working as a nurse practitioner in that specialty area, mental health, and then also what led her to uh, pursuing her nurse practitioner certification, master's degree, and what led you to nursing?
Hello, good morning. Thank you. Thank you again for this interview. Again, my name is Petagaye. I am a psychiatric mental health nurse practitioner. My role and my journey in nursing started off as a licensed licensed practical nurse in 1996. So I've been doing this role as a nurse for many, 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 many years. Essentially, when I started off as a LPN, I was there was a field that we were told would be actually diminished or for anything taken out of healthcare, which is still, as you see, as many of you will see, is still growing. However, it started my journey and it molded me with the desire to move on to become a registered nurse. And my LPN role was approximately 7 years. And thereafter, I went on to become a diploma nurse. So my next journey post LPN was actually through a hospital-based program where they honored my years of experience and my experience as an LPN. And I did that it was brief, but it was, as many of you may not know or may know, that hospital-based programs are really, really good with the critical aspect piece when it comes to training registered nurses. And they've also been kind of faded out, unfortunately, but I felt as if I, learned a lot in my hospital-based program. And that led me, that was in 2004. And I started in a hospital, a large inner city hospital in the Philadelphia area, where from there I grew as a nurse, as a registered nurse. And majority of my my registered nursing experience is acute care. I've done progressive care unit. I have also worked in the interventional radiology department, and I was also working as a medical surgical nurse, which the unit transitioned to just a medicine floor. And there, while I was on a medicine floor, you saw just many variety of different populations of patients, medicine patients. And from there, I decided in that role, in that time, that I, to think about it as a role as an advanced practice nurse. And when I was thinking about advanced practice nursing, two roles that I considered. At first, I considered the education, becoming, nurse education, which is still one of my passions, still something that I think is a role that I am blessed with, because I love to be a preceptor, educate junior nurses, and pass on my wealth of knowledge that I know from nursing onto the new nurses and the next generation. So it's still something I was passionate about. However, the second choice that I had was also to become an advanced practice nurse, advanced practice registered nurse. And when I was seeking out what area I would be, would it be a clin spec? Would it be adult gerontology, family nurse practitioner? I further, with further inquiry, I went on to note that the psychiatric, the mental health population was in more of a need for the advanced practice nurse, and specifically the population for the patients of color, the minorities, the disenfranchised. And that's the population I serve now in my, I serve as a bedside nurse. That was the population I served, where the population were more populations of color, underinsured, uninsured, just basically the ones that were disenfranchised, that just were not, they were overlooked in society and in mental health, especially post-pandemic. You're seeing a rise of people or populations, or the population in it overall, come out and say, hey, I need help. I'm not okay. I need help. And it is even more evident in the minority communities that they need help. But it's harder to say I need help to someone who doesn't look like you. So when you find someone who, hey, this person may understand because we look alike, it helps to break down one of the, if not the largest, the biggest barrier in healthcare is when your provider looks like you. So, as mental health becomes just as important as the physical health, your physiological well-being is just as, your psychological well-being is just as important as your physiological well-being. And we can't take it for granted. We see it every day when we hear stories of people, just couldn't go on anymore, or this person, or celebrities, specifically celebrities who we always think got it together, all that money in the world, all that stardom. They just, life is perfect for them. And then you find out that they were battling with depression, anxiety, bipolar disorder. We see it all the time. And it's very unfortunate. And as a psychiatric mental health nurse practitioner, I am hoping to offer, play my role and in improving a more awareness, increase awareness, and also decreasing the stigma. That's where it is, decreasing the stigma, because it's the stigma.
So a question. Of course. And thank you so much for highlighting that, the importance of having practitioners and healthcare providers that look like the patients. I think that's something that we tend to struggle with, I think, in healthcare, is identifying some of those barriers. We just assume that patients aren't well, or they're not following recommendations because of so many different reasons. Maybe the person just doesn't care about their healthcare. Unfortunately, many healthcare providers just assume that. Sometimes it's issues around assumptions around prioritizing certain things within their care management, whether it's just not a matter of not caring, but maybe there's some issue, some other barrier, maybe something around income, or something that is just higher on that list, and their mental health is just not being addressed. But oftentimes we know a lot of those recommendations would probably be more easily followed if they were talking to a practitioner that they trusted. And I think that that's what you were really saying,
Oh, that's where,
trust.
Yeah, absolutely.
So what skills would you say? Thank you. So what skills would you say a nurse should acquire if they're interested? And I say a nurse, I'm referring specifically to, let's say a year out of nursing school, and they're like, I really do think, I'm seeing, Petagaye, she's a Psych NP, she's seeing patients remotely. I think this is something I really want to do too. What are some skills do you think a nurse, let's say a year, into his or her practice, should acquire if they want to be successful, or if they want to enter into your area of practice, which is being a Psych NP?
Specific skills that I think are required is, other than the obvious, you need to know what is necessary for the diagnosis aspect. But one of the critical pieces that you need to establish on is that, and you cannot hear it, there's no such thing as hearing it too many times in psychiatry, is rapport building, trust, respect. All of those things are essential pieces in order to treat the patient that suffers with a mental health disorder, you have to say to yourself, I want to build a rapport with this patient. I want to understand that, I want this patient to trust me. I want to I want this patient to know that I value their culture. Cultural sensitivity is very important. Sometimes we dismiss things and say, oh, how they are or these people are, and that's dismissive versus, let me understand, let me understand. You have to encourage the patient to express what it is that is specific to their culture that, will bring you a better understanding, a better awareness of how they perceive mental health. Because that's very true. And then you as the provider, your perception of mental health and across all populations, across all ethnic groups, you have to be very aware of your own intrinsic biases too. Those are things that you're going to bring into play, or bring in, I shouldn't use the word play, but will play a factor in how you prescribe. We've heard many stories of, and not to get into anything specific because I can't actually provide citations, but, you've heard many stories about just, for instance, how Black men, I think, I was just looking at something where, Black men in the I'm not going to say, maybe you, the interviewer, can maybe jump in on it, but definitely Black men were more being diagnosed with schizophrenia, where Caucasian men were being diagnosed with bipolar disorder. It was like outrageous percentage of Black men that were being diagnosed with schizophrenia. And I think essentially as we, did more research and had more evidence on it, and when you, just look back on the information that was provided, that maybe essentially they were bipolar as well, or maybe they were misdiagnosed. And so you have to really address the fact that there were some intrinsic biases that were present, as well as, lack of cultural sensitivity, also, discrimination as well, that was present.
Of course. We know that there is not to cut you off there, but we know that there is a history of, questionable ethics around studies and research and medicine and diagnosing, and mental health is such a touchy subject because there's so many different types and forms and levels, and there's so many different diagnoses. Some can be treated, we know, with medications, and some with maybe just talk therapy. Then there's so many variations. However, when you're talking about the provider who's doing it, who's providing the diagnosis, and who's going to be treating that individual, there's so much trust given to that individual. Absolutely. That person is in a very vulnerable situation. So I think I know exactly the study that you're referring to. There was a study, I think it was back in maybe the earlier or late 1900s, where essentially it was the late 1800s, essentially, where they were trying to find out the differences, I guess, comparing from one race to the next. And, this is of diagnosis of schizophrenia or bipolar disorders. And, the funniest thing about it is I find that even when you study the military, there are people who have been, I just recently seen a piece on NPR talking about studies that were, they were looking at different men in the military, and they were active. So at the time, excuse me if I don't have all the perfect terminology, but these were active men serving. And essentially what they did is, with the white soldiers, they actually diagnosed and treated them. And with the Black soldiers, they identified that there was some mental health condition there, but they did not treat them. Mm. And they did that essentially because they wanted to test what it would be like if the person was not treated. How far could things go? And that's something that we know I'm not even going to mention the most popular study that we always refer to, because sometimes it really does that kind of those practices, you know, and highlighting those issues. It does it a disservice when you just bring up the Tuskegee experiment. It would almost seem like, oh, if we could just get over the Tuskegee experiment, you know, we can just get over all of it. And we know that that's not the
many
truth.
more.
So
yeah, when we start to peel away the onion,
so,
we start to see many more. Absolutely.
Of course.
Absolutely.
So
absolutely.
now the question I did have for you, but thank you again for sharing that. You
Yeah,
made me kind of dig into my little history bag. You know, I like to get my history bag sometimes.
Good.
But I did want to find out for you, and I will actually link those two, the study that I'm referring to. I will link it in the description of this video.
Great.
Yes, but so I did have a question for you. What do you think the future of the Psych NP role? What do you see as far as the future? And when I say the future, I'm specifically talking about like remote psychiatric care, as far as, you know, nurse practitioners playing their role in addressing the needs for this vulnerable population. And also, what does that look like as far as remote care? So we know that virtual care is something that we've seen skyrocket since the pandemic. However, there were a lot of companies and organizations, you know, trying to, you know, I guess flirt with the idea of, you know, virtual care. And I think a lot of that had to do with, you know, the patient's comfortability. You know, are patients comfortable with seeing someone and getting their care provided with that type of distance? Would it be the same? And we definitely have seen that a lot of providers have been successful in doing virtual care. So with that being said, enough of me rambling as I do. I want you to explain to me, what do you think the future of Psych NP's role, especially as it relates to remote care?
Sure. Let's see. First, the future of the Psych NP role we know is advancing, and it is advancing quickly. We still, as I stated before in the beginning of the interview, we still have a ways to go when it comes to minority providers, or providers, excuse me, of color. However, the role of the psychiatric mental health nurse practitioner is expanding, and in America is expanding quite quickly. With that being said, you know, we still have to respectfully honor and all the great psychiatrists that are out there that are actually opening that gate for the Psych NP to come in. And I'm going to speak specifically for Pennsylvania. You know, across my journey, my training, I was trained by 3 psychiatrists, 4, actually more than that, maybe up to 5 psychiatrists when I was doing my clinical training. And I personally actually did not, I only encountered 1 psychiatric nurse practitioner in my journey when I was actually training. However, when I, you know, was, you know, during my clinical training with the psychiatrists, they acknowledged and knew that the role of the psychiatric nurse practitioner was emerging, and it's going to be a big deal. It's going to be a big deal. And the need is just so great. And when you look at how the psychiatric nurse practitioner can provide care, especially specifically remotely, it can cover more patients. It can decrease barriers. You know, when you think about telehealth originally came out because of rural communities. You know, so telehealth is not nothing. It's not a new thing. It's not a new idea. It's just it was specific for rural communities. However, now you know, as the interviewer would say, as you were saying, that you know, as now that is post-pandemic or during the pandemic, mental health was not put aside, but there was some, you know, question of, oh, how are we going to treat these patients? Because, you know, we can't, how are we going to treat these patients with the pandemic going on? But they needed the care just like any patient that needed you know, medical attention for a medical condition, obviously. So with that being said, we understand and note that the role of the virtual mental health practitioner is here to stay. The remote role can cover more, as just to speak as an actual provider. I can cut, as a provider, I am licensed to practice as a registered nurse or a provider in Pennsylvania, but I hope to branch out and cover more states. I definitely am considering, because Pennsylvania will be switching over to compact licensure as an option. So I'm hoping to, definitely have expand my patient population outside of the Pennsylvania area. And with that being said, it definitely decreases the main barrier of why telehealth became, an initiative, is because you get more access to more patients and they get more treatment no matter where in the country they are. So with that being said, it's definitely decreases a huge barrier. And with the remote option, if you just want me to talk just about the piece about just how it is as a provider, some of the perks that I'm going to say that comes along with it is that, you can see your patients in the comforts of home and still deliver full effective care. They can still get everything that is needed to be provided and get a full psychiatric medication management visit, evaluation, treatment can all be done at home.
Can I ask a question?
Yes.
Regarding, so you just said something that struck me. You said that they would be able to get the same quality care. So now I'm just curious. Mm-hmm. What does the barriers look like, or your experience has been with the barriers around using technology? I'm assuming that for some patient within your population, I mean, in generally, patient populations in general, but specifically in your population, with the population you serve, I could imagine there being some barriers around, like, let's say, like, video call, or, has there ever been any kind of barriers like that as far as a person not knowing how to use devices?
Okay.
And also, does it have to be face-to-face? Is it sometimes face-to-face? Is it strictly telephonic, or what does that look like?
Well, good. Very good. Very, very, very good question. Okay. So number one, you have your patient population who still have not been able to successfully use a Zoom or a virtual visit. So unfortunately, their calls have to be telephonic. But as a psychiatric nurse practitioner or as a mental health provider, number one thing that you remember that you'll learn is, outside of what you can assess, from an objective perspective, psychiatry is subjective. A patient comes to you and says, "Hey, nurse practitioner Reyes, I had this, that, and the third symptoms going on." It is one of the more subjective patient populations that when it comes to reporting symptoms. So essentially, when you encounter your patient and they give you a list of symptoms that they've been experiencing and the mental distress, then you can create a treatment plan for the patient. So not seeing the patient virtually does not essentially make it that much of a barrier. Now, there is a small percentage of the population that it can become a barrier with. For instance, you may have a patient that is, a schizophrenic patient. They're good examples of patients where preferably you want to see them in person or virtual. You would like to see them. You would actually want to see maybe even their background, how they dress, their appearance. That can be of concern, because self-reporting with patients like that, you can obviously pick up in their conversation there's an issue, because there's some key pieces that are attached to psychiatry, as far as the positive symptoms of hallucinations, delusions, paranoia, so forth and so on. So you can always pick up it within the conversation. However, you may have a patient that you may also have other patients, that are concerned, they may report something, but virtually seeing it through, seeing them, their movements or their movements and their expression virtually may be helpful, but it's not a barrier where those patients may have to feel, because, you have also depressed patients who don't want to leave the home. You have depressed patients who don't want to leave their bedroom. They don't even leave their home, and you have to get to them where you can meet them. So, it's like how you have mobile crisis. We're almost like a mobile crisis to them, obviously not the same, but we're meeting them where they are. You have these patients who say, no, I don't want to be outside. I'm scared of outdoors, and then in order to get them treatment, you have to meet them where they're at, literally in their home, and deliver care and start to get them, transition them out through with, medications and also psychotherapy. And it all can start within the home. And as the provider, you can deliver it, you can provide the treatment via your home, and they can receive it via their home and still be successful, whether, still be successful if they were doing it in person, in person
Now,
is go ahead. No, go ahead.
well, I'm sorry, but you said something that struck me.
Go ahead.
So as you have worked primarily, most of your nursing career has been at the bedside, and now you are seeing patients, virtually, and you're seeing them in their home setting. So we know that there's been a shift from inpatient care, just in general, not just in mental health. Mental health is just an aspect of, we're just discussing that, of course, because of your specialty area. But there's been a shift. So there's a shift from inpatient care to maybe more so care at home. So as care shifts back to the community and to home setting, and I'm like, even the services that you're providing, what do you think nurses who, because you mentioned some of this earlier about those skills that nurses could develop now, which is that cultural competence, which is that sensitivity to what's going on in the patient's home, their living situation, their community, and understanding and having sensitivity to that, so you can be more effective in your care management. So what would you say a nurse who is working in the bedside right now can do to develop those type of skills? Those specific type of skills?
Okay. Some skills that are some critical aspects before you go and transition into mental health, but even simply as a bedside nurse, as I stated before, you can't overemphasize trust and respect, rapport building. Remember, as the nurse, as the registered nurse, or even the licensed vocational nurse, you are the patient's advocate. You are their advocate. I mean, when no one else is advocating for them, you are their advocate in the absence of their family and in the absence of them being able to advocate for themselves. So they essentially expect you to be, you know what, I trust my nurse. My nurse trusts, I trust my nurse. My nurse shows respect for me. She is actively listening. She is, actively present when we're engaged and talking. She's he or she, excuse me, is showing concern, actively listening, offering information, offering resources. There's just, how could I say, there's quite a number of things that you could do as the bedside nurse. I mean, obviously, critical thinking skills come in different variations. From an ICU, there's ICU critical thinking, and there's mental health critical thinking. So when you think of critical thinking, critical thinking is something that you have to be clinical setting specific. However, that is a very important piece. Nurses, when a patient has faith in a healthcare provider, they feel more at ease and more comfortable, because moving forward, this person is fearful, whether it's prepping for surgery or is this person grieving for a loss. This person is fearful. They're in a bad position right now, and they need that reassurance. And it can't be false reassurance. It has to be reassurance with confidence. Like, no, we have the right tools to get you through this process. No, you're getting care from the best surgeon. No, you're getting the, this is how we do it. And you have to kind of move with a confidence. But when I say confidence, I don't mean, a new nurse 1 year in can have confidence. It's just, time management plays an issue. How you engage with the patient plays an issue. So there's so many essential pieces that you can learn as a bedside nurse before you transition into an advanced practice role where you're the provider, you're the clinician, you're the one,
Thank
you're the
you.
go-to person. You don't have a doctor to go to, it's you.
Thank you. And so as we are headed towards the end of this chat, which I want to thank you so much for taking the time to speak with me. One
My
of the things
pleasure.
that we really like to do is we like to motivate nurses to challenge themselves to go to the next level. And it can be scary sometimes. Sometimes nurses get really comfortable in the areas that they're working, their specialty area, where they, this place where they've been working a long time. And maybe they say, I want to, maybe they're saying to themselves, I want to move on, I want to advance, but how do I do that? As your closing remarks, would you mind giving words of encouragement, advice, suggestions of how a nurse can prepare themselves for to become a nurse practitioner? And when I say that, I'm specifically saying, like, as far as the application process, how should they feel about that? Like, say if they apply to 1 or 2 schools, they don't get accepted, should they consider that as a sign? Should they continue to apply? Also, for anyone who's studying right now, who's not passed their NP certification, would you mind giving some advice around maybe ways to study or prepare for that exam if they are preparing for the exam, or maybe it took the exam and they failed the first time? What advice would you give to that individual?
Okay. Well, first, let me answer your first question. Is that when deciding that, okay, I want to advance my role as a registered nurse, I want to go on to be an advanced practice registered nurse, whether it's a clin spec, a nurse practitioner, or an anesthetist, you obviously have to do your research. That's what we base nursing and healthcare on: research, right? Evidence-based practice. So you essentially have to do your research. One of the key things that you could do is obviously what's important to you. You have to say, is it cost? Is it the ability to do everything virtual? Is it online learning, self-learning, adult learning kind of thing? Do I need hybrid? Do I need to be in person? How long is the program? How flexible is the program? So you have to kind of write down a list of, hey, what's important to me? And I know personally for me, when I took this university that I went to, it was a local university. However, my program was it was hybrid and it was online. So it was 7 weeks. Most of my courses were 7 weeks until I got into the semesters where I had to do clinicals, which was your average 15-week college course. So for me, it worked for me. I did my 7 weeks per subject. I didn't, I think this, if it was advanced pathophysiology, that was 7 weeks done. That went on to advanced pharmacology, 7 weeks done. And that worked for me. I had access to all my professors, my instructors. We did some Zoom sessions during the whole school term. I did schools, they were available and accessible. Some, most of it was optional. So it was flexible in that sense. And I think flexibility as an adult learner is the biggest piece. Obviously, money. Some people want to do, I don't want to pay. I don't want to take out another loan. I want to be able to pay for grad school. That's important. You need to find a university that is affordable. And you also maybe want to consider a university where, okay, maybe I thought I wanted to do psychiatric nurse practitioner, but now I want to go on to be my FNP. Do they provide that alternate track? That's very important. So all those things you have to take into consideration. And one of the biggest things that I didn't utilize, but I realized from talking to my colleagues that, this played a big role, is finding a mentor. If you find a mentor, mentorship is very important. So if you find a mentor, someone who can help give you guidance in that role, if you want to become a clin spec, find a clin spec in your hospital. If you want to become a nurse educator, find a nurse educator in your hospital. And that person has been there so they can also offer guidance to you. It's very important that you seek out that guidance. It could be helpful so that you feel like you're not wasting your time in areas that you don't need to be wasting your time in. And let's see, in conclusion, I just think overall my desire to become a psychiatric nurse practitioner, as I stated in the beginning of the interview, wasn't an overnight thought, but as I as I move forward and as I move forward in the role, I believe that it was one of, if not the best decision, and preparation as I got towards the end of the program, because you're going to learn so much in your nursing program. It's going to be high, it's going to be high impact. There's going to be times where you don't know where you're, if you're coming or going. However, as it came time to prepare for my exam, one of the things that I said, that's why getting a mentor also is helpful too, is that you can find out, okay, how did you prepare for your exam? And I encourage review courses. Most of my colleagues use a review course, including myself. I encourage you to use a review course and find a reputable one. You can always say Google reviews are the best thing that could ever happen. You want to know the person's pass rate, but Google review is it's a neutral forum. So it's like you can go in and see what other people are saying about this. Obviously, you'll find some consistency, some patterns, and then you can decide, okay, maybe this one is not for me, maybe this one is for me. But there's a lot of resources out there for exam reviews. There's apps, digital, you have apps that you can use for board questions. Then you have, like I said, interactive reviews that you can utilize. They're a little bit more money. And then most of the testing, the credentialing bodies that give out the exams, they're ANA or ANCC. They can, obviously, if you go through them, they actually have their test banks too that you can utilize and purchase. So, when you move on, as you move through your journey, I always say, there's no such thing as any dumb questions. Seek advice. Just don't do things haphazardly, because you just, you don't want to waste your time in areas that you don't need to be. So any nurse, young nurse, or seasoned nurse that's considering going back to become an advanced practice nurse, good luck. It's well worth it. You have to put the time in to get it done. But at the end of your journey, you'll be very pleased with the outcome. Thank you.
And thank you so much. Again, I do so much appreciate the opportunity to speak with you. I know that you are very busy, and I know that both of us we both work remotely, so we're kind of in our own little home offices. So I thank you again for dedicating this time to share with my viewing and listening audience.
My pleasure.
And I will echo what Petagaye said, and I just want to just really, really stress the importance of this. It is so important for you to have a mentor. A part of my services is to extend that mentorship service to you, extend that assistance to you. And the reason why I have so many different people that's in my network is because I want to be able to refer anyone who's interested in getting similar services align with what your educational pathway is. If you want services aligned with your educational pathways, I want you to reach out to me. You can reach out to me at advanced nurses at ACD4N. Again, that is advanced nurses at ACD4N.com. You can also message me at www.acd4n.com/contact and leave a message on my contact page. Thank you very much and have a wonderful day.
Thank you.
Thank you.